Hi, thanks for joining us for Facebook Live today. This is a global audience today. We're so excited to have our friends from the United States and Europe and all over the world joining us. Probably a lot of your friends from Brazil.
Hopefully. Let's see how much of a good friends they are.
Popular guy. I'm Melanie Jones. I'm from Ultradent and I'm your host today. We're joined by Dr. Rafael Beolchi, who, as I hinted at, is from Brazil, joining us this week for the Ultradent Summit. Thank you for being here.
Thank you, Melanie, for the invitation again. It's always good to be back here.
And little known fact, it's actually this guy's birthday today.
Oh,
Happy
yeah.
birthday.
Thank you.
And
Thank
thanks
you,
for
Melanie.
spending it with us.
It's not easy making 20 years, so it's a tough time for me. It's been 22 years ago, but anyway.
You hold your age well.
Thanks.
So we're going to talk today about tooth whitening. Are we live?
Yes.
Sorry, it's not showing on Facebook. We may need to start again. Oh, we're live. Okay. That happens sometimes. You know me. I'm
This is show business.
Kind of crazy. Show business. So we're going to talk about the Opalescence tooth whitening line today. And I'd like to start by asking you, Dr. Beolchi, you've traveled all over the world, lecturing in all different places. Some tooth whitening products have arisen locally that are manufactured locally. Can you tell me why you would choose to use something like Opalescence compared to a local, cheaper tooth whitening product?
I think there's so many reasons I will stick to, to a more known, to one that I trust. But if I have to make it only, to abstract it to only one word, it would be stability. We have to trust a product that has stability. And why stability is so important? Because everything that we need, everything that we want in a good bleaching procedure, in a good treatment, comes from stability. So let's say a wider result, something that doesn't have that much or any sensibility, I think it comes with a product that is stabilized. And stabilizing carbamide peroxide or even worse, hydrogen peroxide is not easy. But with this stabilization, we have a better result in terms of everything, in how fast it is and how wide it is, and with lower sensitivity, even without sensitivity at all. I think that will be the main thing, and choosing something that is more trustable is something that has this stability. I'm concerned about, the local, because it's not difficult to fabricate, to manufacture carbamide or hydrogen peroxide. The problem is stabilizing it. If it is not stabilized, how can you trust? How do you know what is the percentage, what is the pH? And the outcome of our procedure comes also from the material we choose. So stability, I think it is the main thing we have to look forward on a good bleaching product.
Great points. It's so interesting that it's easy to manufacture carbamide peroxide, but not easy to guarantee stability. That's a really important point.
Yeah.
Another thing to note is that the Opalescence tooth whitening line is a full line. You have a tooth whitening menu. So we're going to talk about all of the different tooth whitening options available in the Opalescence line. I believe you've used all of them.
I think so.
I think so.
There's some that I use more, some that I use less, but
we'll talk about that too.
Cool.
So I'm going to show you a little bit. Over here we've got Dana from our dental lab, who is an expert at creating custom trays. She has made thousands of custom trays over the course of her career, and we're showing you a little shot of that now, and we'll come back to it in a minute. But it's so important to fabricate your trays properly. It affects everything from patient comfort to actual sensitivity. So we'll get back to that in a minute. We're going to start with the lowest barrier entry whitening product, which is Opalescence Go. Now, Opalescence Go is a newer product for us, but it's been around a few years still. And I'm going to put in a tray so that you can see exactly how this works. Now, Dr. Beolchi, while I'm doing this, you use Opalescence Go on your patients all the time, correct?
I use a lot, and I think it is unique in a sense because it's basically, one size fits all. It might seem strange, but it's not, because the technology involved in the tray that will do the job, not the outer green tray. The green tray is only a way to take the inner tray, the white tray that we're going to see in a few moments. But this inner tray seems like something simple, but there's a lot of technology involved there.
A lot of technology.
And I like how the body temperature sets the tray, and it confirms with the gingival arches of every person. So it is kind of one size fits all, but the tray itself adjusts itself, and it adjusts itself good enough for the amount of time that the product is supposed to be used. So it's around 30 minutes to an hour, depending on the concentration we're using. I use a lot the 10% concentration in Brazil. I use a lot the 10%. It's hydrogen 10%, so we're not supposed to sleep with that. We're going to use for 30 minutes to an hour. Me, for instance, I have to do that. Okay, this is going to be my tray. Nobody's watching that, because I have to do a little retouch here. I'm using all the
You know what? You've got
Go.
connections. You don't even have to steal it.
Oh yeah, no, I'm not stealing. I'm only, like removing from sight and without anyone seeing.
And what do you call that in Portuguese?
Stealing.
Oh, okay. So I'm going to place this tray, and as Dr. Beolchi said, this tray conforms, the inner tray conforms very well. It's super comfortable, and in fact, we say that you can whiten while you're doing pretty much anything. So today, I'm going to whiten while I Facebook Live, and we'll see how well I can talk. Okay, so you notice I did not press and I did not bite down on the tray. Sometimes if you do that, the bleaching material can kind of leach out the top.
Yeah, I think this is important.
Yeah,
an important tip to give. I say that to all my patients, every person that I use the Polescence Go, is you shouldn't use your hand. Your hand is only to place the green tray into your mouth. Then who's going to do the job? The lips. You give a little kiss on the green one, you remove the green one, you give another little kiss, and that's it. That's what you need. You don't have to press, you don't have to push, you don't have to do anything. If you press, I think it is worse.
Yeah.
In some minutes, like 2-3 minutes, Melanie's body temperature will set the tray in position. So the tray will set itself in position along the arches. It will remain there for the duration of our Facebook Live, and even a little bit more. But again, I think it depends a little bit also on the patient. I don't know, how much time do you feel comfortable using the opalescence? This is the 10%, right? Hydrogen and gas.
This is the 10%, yes.
I tend to use from 30 minutes, 45 minutes, after 1 hour. And this is also good because we're talking about the menu, the how many products that we have. It's very easy to fit each lifestyle, each, a preference for the patient. I'm too, I don't stand still for too long. So 30 minutes for me, 30 minutes, 45 minutes for me, it's good enough. And it will get good results. But there are people that they can, stay for an hour, sometimes 1.5 hours. You're not supposed to sleep with that.
And the tray isn't custom, so sleeping with this is...
Yeah, exactly.
I mean, you probably flick it with your tongue. You might... it could be dangerous, actually.
Yeah, exactly.
So this isn't...
It's 10%. It's not made for that. It's not made for that. But it's very... feedable. The opalescence Go is very feedable. It's very, and one thing I like, Melanie, it is you don't have to. It is right on time. If the patient wants to bleach, you don't have to take an impression, call the patient again. Let's say 1, 2, 3 days. It's right there. You already give him the box.
Immediate gratification.
Exactly. And I think it is another good thing about the Polescence Go. It is fast. It's already there. It's already, for purchase. It's already available for the patient. You don't have to take an impression, and the patient doesn't have time for a second thought. I might not use that. I might, go dinner with somebody. No. It's right there. He's gonna use. He's gonna be happy with the results.
And it's profitable because you don't have to figure in any lab fees or time for your staff to create this tray. There are no additional products required, no stone, no block out, no labor. Everything you need is right here in the kit, and everything that you make is profit. Now, what I have in my mouth is 10% hydrogen peroxide in the mint flavor. Different countries have different concentrations depending on what is legal in that country. So, for example, the European Union, Opalescence Go is a 6% instead of a 10%. But still very effective and always very comfortable. Now, Dr. Beolchi, who would you consider to be the ideal type of patient to use Opalescence Go compared to another type of whitening product?
I think it is easier to say who's not the ideal patient, who's not going to be the ideal, depending on what kind of stain, what stained the tooth. So let's say root canal treatment. The tooth got dark because of root canal treatment. Okay, this is not a case for Opalescence Go. We have other materials that we're going to discuss about those materials. Another kind of patient that I don't think it should be a good idea, a patient that doesn't follow rules very much. You know, patients that you don't trust very much in using. I think it is easier and safer to go with lower concentrations of carbamide peroxide. So I think it is easier to say who's not the ideal patient. I think those cases...
tetracycline.
Tetracycline because tetracycline is also a case that you're going to need what? You're going to need a longer period of time. So you have to use lower concentrations for extended periods, let's say months. We're talking about 2, 3, maybe sometimes 6 months of use, not consecutive many times, but then you're going to use probably carbamide 10, carbamide 15, but not the hydrogen 10% or 6% as in the European Union case.
And in that case with tetracycline, you'll use a custom fabricated tray. So now we'll show you how Dana has progressed on our whitening tray. She has trimmed it, and she says it's very important to trim to the gingival side of the border that you see on the vacuum form tray. And this is because when you flame polish, it's going to shrink. The tray is going to shrink. Let's talk about flame polishing for just a second. Dana can show us some flame polishing on that model over there. So she puts the tray onto the model, and she gets her finger wet with water just because she's using fire. And she'll just wave that flame over the borders.
There's
of
one
the
little
tray.
tip I think it is important. When you're trimming the tray, it is important not to trim on the line that we see on the gingiva. It is important to trim a little gingival, yeah, not towards the incisal, towards to the gingival. Why? When we're flaming, we're gonna round up, you know, the edges, so they're very comfortable, but the tray might shrink a little bit, exactly to where we want the tray to be. And I think it is important to trim the tray because we can, in that way, we can prevent sensitivity on the gum, you know, on the embrasures. And I think it is important. Some patients I don't trim, but most of the patients I think it is important to trim to prevent this kind of sensitivity on the gingival tissue because of a tree, maybe because might be some peroxide there. So properly trimming the tray and flaming, it's more predictable, more comfortable.
Right, and just the trimming is not even enough. The flaming is important because when you trim, sometimes there are sharp edges, and so the patient can complain to the dentist, I'm having sensitivity on my gums, and they think it's from the chemical in the whitening agent, and actually it's because some sharp edges of the tray are poking their gums. So flame polishing really helps with sensitivity complaints. Make sure that your trays are fabricated
but not
properly.
Tooth sensitive. Many times the sensitivity doesn't come from the tooth, comes from the gingival tissue. But the patient, many times, they don't realize, they don't notice that. So it's also very important to have a very nice and custom tray done for those cases as well.
Yeah. Now, in the case that there is true sensitivity, would you talk about Ultra Ease for
Ultra
us?
Ease, yeah. Ultra Ease is a great product. I think it is good for the cases in which, let's say, the patient already is facing and having problems with sensitivity. Ultra Ease doesn't, it's not supposed, you know, to fix any problem. It's not that it is a free ticket to do whatever you want and then you can fix it with Ultra Ease. Ultra Ease should be used only on the case the patient is feeling discomfort. But I think it is our main goal with the menu that we have in hand to opt to a treatment that doesn't generate sensitivity. But some cases, we have hypersensitivity in many cases, in many patients, and that's what Ultra Ease is for. So it's not a free ticket to do whatever you want, but to take care of those hypersensitivity patients, it is a great tool. You can use with a tray, but I think also it's available yet on a custom tray Also, and like the opalescence Go or anymore?
In the Ultra Fit tray.
Ultra Fit as well.
Yes.
So it's
Yeah.
another thing that is great to use
Yeah,
as well.
so that's a potassium nitrate gel. So a lot of the time you'll deliver that in a custom tray, and I'm going to show you now a custom tray with our lovely volunteer, David. You may recognize David. He is a model for our current opalescence campaign, My Smile is Powerful. So he is going to show you how his custom tray fits his teeth.
First of all, I'm going to fill it up. This is opalescence 15%, carbamide 15. It's very easy to fill it up. You can go with a straight line. I'm going to do from first molar, okay? Maybe there's no problem. Nobody's seeing your second molar anyway. It's very fast, very easy. One straight line is over here. I think it is easy to perceive and very easy to use as well.
And now to show you the difference. So David's wearing a custom tray, and I am wearing the Opalescence Go Ultra Fit tray. Thank you so much for demonstrating, and we'll see you later. We'll see you on the camera. He's great to help us out with all of our campaigns. He has a great smile, and also he's an associate brand manager for our tooth whitening line, so he knows all about this stuff. Let's talk about in-office tooth whitening. So we have a variety of in-office tooth whitening options, and the first one I'd like to discuss is Opalescence Boost, which is our chair-side whitening. I think you brought some clinicals that you can show.
I brought Opalescence Boost. I think it is a very important tool because it gives, I don't see Opalescence Boost. Sometimes it can be the whole procedure, but I see as a starter. I think it's very good to combine, both treatments to get the best of both worlds. A faster treatment with the boost, that's what I get, is a faster. But with the trays, if I combine the treatment with trays, generally I have not only faster, I have also wider and a long-lasting treatment. A treatment that won't last, only for a few months, maybe a year. It's going to last for, depends that on the patient, on his habits, but it will last at least, let's say, 2 years averagely, sometimes 3 years. So combining, I think it's a very good idea, the boost. And this case I want to share with you, it's a case done actually by a good friend of mine, Fernando. I hope he's watching that. Fernando Rigolin from Brazil. And he did a very nice case with this patient. We can see here that this patient was kind of an A3, let's say, if we're going to measure through the classical Vita Shade guide, around A3, A3.5. And Fernando did a very good job combining the products using the Opal Dam green. We're going to see the Opal Dam again when we're talking about Opal Luster. And he used the Opalescence Boost, so it's 40% hydrogen peroxide. He did 2 applications of 20 minutes. The patient, this is a very good, very fortunate patient. He had no sensitivity at all, and that's why Fernando was able not only to perform Opalescence Boost, but immediately start using Opalescence PF. He used PF for a week, the 10%. Then the next following 2 weeks, he switched to 15%. Then he came back to the last week on 10% again. And I think we can see here the final result. It's a very good result, it's a result that we can trust. It's going to be a long-lasting result, something that it's a white that we get, but that will remain. We can trust it will remain there for a longer period as well. So we can make the treatment a little shorter, and the patient already see the results when we're doing the in-office, but with the trays we have this, long-lasting effect, and probably we go the extra step in whiteness as well.
So Boost can also be a motivator,
Exactly.
right, to continue the treatment and be compliant with the treatment. Great point.
And the first person that pointed me out, this Renato Miotto. He's an endodontist, the guy who taught me most what I know about bleaching.
Weird, right?
Weird.
An endodontist, but he does a great lecture.
It is amazing how much he knows, and this
About tooth
point
whitening.
exactly,
It's
and
amazing.
his point of view, you know, with a biological point of view, I think it is very important. And he gave me this insight: if we know what we're doing, and it's very easy to do when you trust the material, is that you get immediate results. The patient feels motivated, and that increases a value to the procedure. That is, you know, it is. Amazing. And the first one that pointed me out that how important it is to have the best of both worlds, something that is fast but something that is long lasting. And to combine the best of both worlds in a treatment, I think it is good. And the case that I shared with Fernando, I think shows that and portrays that very well as well.
Yeah. We're already receiving some questions. Hang in there with us. We are going to have time for Q&A at the end, but I see you. Hello. The next product I'd like to discuss is Opalescence Endo. And I should have mentioned with Opalescence Boost, again, like with the Go, it depends on what's legal in your country. I know in the UK, Opalescence Boost is only for tetracycline, if I'm not mistaken. So different products are available in different countries and with different concentrations, and it just depends on what
legislation and
the legislation is. Exactly.
Each
So
place.
Opalescence Endo is a 35% hydrogen peroxide product, and this is used for what is typically called the walking bleach technique. And can you describe how that is used?
Yeah, the walking bleach technique, I think it is a very important one. I think there's some variations for that as well. So this is what we have. It is, let's say, it is stronger, but a little weaker than the Boost, but way stronger than PF, let's say. And it is meant to be inside the pulp chamber for, let's say, some days, 1, maybe 2 days, and you have to switch that from time to time. Let's say a week, you have to switch from time to time. This is for more, you know, resilient stains, the endo stains, and we have very good results as well. But I think it is important to mention, I already had very good results also using the PF. Some cases there were a little, you know, I'm not an endodontist. I don't have the talent that Renato has, you know, to take care of the root canal. Sometimes I might be, let's say, I'm a little scared to use that. It's too strong. Doesn't mean you have to always use this one, okay? You can sometimes use, and I use also the PF, let's say, on the 45% carbamide, and I also get very good results. So again, all comes to when we started our conversation is stability. If you have stability, concentration is a matter of how fast you can go with the treatment. But results you're gonna get either way. This is, I think it is the coming back to when we start, why stability is so important.
I love this syringe.
Oh yeah, this is amazing.
First of all, it's very brightly colored and you don't confuse it in your tray with any of the other products. And that's because this is hydrochloric acid. So anytime you see a syringe from Ultradent that is very bright and obnoxiously colored, it's probably a strong chemical like this one, this hydrochloric acid. And it is a slurry from enamel microabrasion. Have you used this product as well?
Yeah, but I like to share a case from a good mentor. He's a teacher, a mentor, a good friend, I can call a friend, Dr. Renato Sandfeld. And he has, you know, extensive work on his lifetime using this kind of material, microabrasion. And I would like to share exactly, it's his case. If we have stains that are not inside of the tooth, they are on the outer layer of enamel, sometimes those stains, they are resilient to bleaching with carbamide or hydrogen peroxide. Sometimes we have to remove a little bit. So it's a small film, let's say like this, of the enamel. So that's the idea of Opaluster. So it's a slurry, it's a paste that has hydrochloric acid. And the idea is you place that above, we can see here on the slide, we have a very dark stain, but this stain is resilient to bleaching with the regular products, carbamide or hydrogen peroxide. And we have to use that paste with some friction with a cup that comes with the kit. And after some procedures, usually it's not only one application, maybe 2, maybe 3 applications, depends on the case, obviously. But if those stains, they are on the outer layer of enamel, we can get very good results as well. So it's a microabrasion technique. It's not, let's say, a bleaching on the concept that the carbamide will gonna break the stains inside of the tooth. We're removing a little, small, very thin layer, less than 1/3 of a millimeter of the enamel to remove those stains if those stains are in that region. So it's very conservative, but only for those, fluoride stains that we can have.
Mm-hmm.
There's also a video I would like to share. I think it is important.
Well, before you jump to the video, yeah. I'd like to make a comment about this. I think this is actually Ted Kroll's case.
Done with Renato Sandfeld.
Oh, they did it together.
Yeah, they did it together. And they wrote the article. Good you mentioned, because Theodore Kroll, Professor Theodore Kroll and Professor Renato Sandfeld, they have very extensive work together. And this article they wrote together, and they have a follow-up, very beautiful article. Because this case was in an article, if I'm not wrong, maybe 15 years ago, and they have a follow-up. Yeah, they have a follow-up. They wrote another great article. I highly recommend reading both articles, because there's two persons in this world that know this technique. It's Renato Sandfeld and Theodore Kroll, and they work together.
Perfect.
Good you mentioned, so to be fair
right.
with both of them.
And Dr. Kroll mentioned to me that this case, it was opal luster followed with 21 days of home bleaching. And this brings up the question of which one you do first, opal luster or the home bleaching. You can do it in either order. If Dr. Fisher were to do this case, he says he starts more conservatively. So he would start with home bleaching and bleach as much as he could, and then finish with the opal luster. But in this case, opal luster came first. And honestly, if you want like the wow impact for your patient,
you do
starting with opal luster. No, I think starting with
opal luster. Yeah.
The patient walks into your office one way,
and
walks then they hold up a mirror, and there are so many anecdotal cases I've heard of the patient just bursting into tears because they know that how long does this treatment take?
Half an hour,
Half an hour
to
an hour. Their life completely changed in the course of 30 to 60 minutes. You have a video. I interrupted you. I do that.
The video I want to share is a video of the procedure of using opal luster. It is important. Hydrochloric acid, it is not like phosphoric acid, but also it's an acid. So it's important to have some isolation. Here we can see the opal dam in action. It's very important that we seal all of the embrasures, all of the gingival contouring. There is no problem. Actually, it's even better if you overlap the opal dam a little bit into the tooth. It's also very important before photocuring, before applying opal dam, make sure that the teeth and the gingival tissue is very dry. If it is very dry, the opal dam will stick very well. You photocure it in place, you can trust it will remain in place. And here we can see the opal luster being used. They're switching placing the tip. It's important to express a little bit on the pad to see if there's a even flow of the material. So you use the material, you use a cup, and this is the idea. What is being performed here is a microabrasion. So it's very, very conservative. It is very easy to control what we're doing. So you do one application, you can do the second application. Pediatric dentistry uses that a lot. You remove the opal dam. You noticed that it was used also a rubber dam isolation. I think it is also important. You might use an emelast at the end of this procedure or fluoropal. One is a varnish, the other one is a gel. So fluoropal is a gel. As we can see here on the tray, there's a fluoropal being used by Rich Tuttle, Dr. Rich Tuttle. We tend to call friends by their names, but Dr. Rich.
I call you by your last name. Hey, Beolchi.
That's the idea. I don't like being called doctor. I was not born a doctor, so. So that's the idea of opal luster. We can see here the before and after, and that takes, like the procedure takes 30 minutes. Things, hi, how you doing? Good morning, and okay, bye-bye takes less than an hour. So it's a very fast procedure and usually very predictable as well.
Mm-hmm. Perfect. Now, while you were showing that video, I took off my tray. So I will admit that on Monday, I also used Opalescence Go for an hour, but I only used it on the top, and just now only on the top, and I'd like to show you the difference between the top and bottom, just what you can get for this limited time that we were on camera. So, am I close enough? So, remarkable results for that short period of time. And you may have forgotten that I was wearing that tray the entire time that I was speaking. But the difference between top and bottom, and I was able to go on with my life, do what I do. You can wear the Go tray while you're doing so many things, whether it's exercising, taking a shower in the morning before work, doing a Facebook Live. Opalescence Go can be worn in any of those situations. So I'd like to open up now for Q&A. We have received some questions. One thing I'd like to start out with that I saw on here is laser bleaching and the myths around laser bleaching. Can you speak to that?
This, I don't know if this is an expression in English, but this is a snake that is hard to kill.
A snake that's hard to kill.
It is an old story.
I like it.
It is an old story. It's been almost 10 years that we know that lasers, any kind of light, any kind of energy, that doesn't make any difference for the bleaching procedure. I'm not saying that lasers doesn't have a role in an anti-inflammation and everything. They have, we know that. But for the bleaching, for the results, any laser, any lights, any energy that we place doesn't make a difference there. Again, I would like to quote Renato Miotto as one, but we have several, very extensive information on that. But it is, again, is a subject that keeps coming and coming. Right now in Brazil, again, it rose again from the dead. So it is really hard to, to keep science speaking, because marketing, I think in that sense, made a huge blow on the last decade, a blow that still, echoes until today. So we know that there's no point on using. You should trust the gel. You should trust the material, the gel, the carbamide or hydrogen peroxide. They're the ones doing the job, not the laser.
Yeah.
So
and
again,
what you said is important. It's marketing, and it's marketing to the patients too. I know that some doctors feel like they have to offer a laser whitening so that they can be seen as high tech. But Dr. Jamie Morgan, she always says, she just responds to her patients, oh, that's like 10, 15-year-old technology. We have the new stuff here that doesn't even need a light.
That's a good approach. That's a good approach. I remember Gerald Kugel on one of his lectures, he said that how do you approach that with your patient depends on your relationship with the patient. Mm-hmm. My relationship with the patient is one of confidence, of trust, of letting him know that I'm, I try to be updated by lecturing and everything. It's an obligation with the audience and mainly with the patient. So that's my approach. I know people, they use a lamp from far away, so there's no effect, only the marketing effect. But I think that depends on the relationship each one has with their patients. Mm-hmm. This is, I'm quoting Gerald Kugel, and I think it is a good way. I don't think we have to fight that much, but at least to know that there are risks involved when we use lights for bleaching. There are risks involved, and there is absolutely no benefit for the bleaching.
No, thank you. We have a question from Ashley Spear, actually Ashley Stanford, sorry, married name. I happen to know her. She's tuning in from Australia, and she would like you to talk about the charcoal whitening.
Oh, it's also a trend there. Also, I thought it was only in Brazil. Also, it's very abrasive. On the long term, it will bring problems. Does not bleach. It's a polishing, but a very rough polishing. You should not use that for extended periods of time. It is also a trend in Brazil. At the same time, I like to quote two friends in Brazil, Garofalo and Alexander Nishida, and they have very good posts on that. They're also teachers there in Brazil, and they're talking about also on the lasers, how useless they are, and how dangerous can be the charcoal as well. So there's no effect. It was like, some paste, some toothpaste, let's say from 80 years ago. They also had this effect, but at least they were less harmful. They had talc in that, so it's titanium dioxide. Titanium dioxide at least were less harmful than charcoal. So there's no bleaching effect. There's no magic involved. On the long term, it can be dangerous for the enamel. You know, it's too abrasive on the long term, on extended period of time of using that.
Thank you. We have a question from Maria Umpierre. I hope I'm pronouncing that correctly. I hope you'll forgive me if I didn't. She's asking about Opalescence Go. She loves it. This is actually a question for me. She loves Opalescence Go and is irritated to find it on Amazon because it should only be available through dentists. So let me be really clear. It is only available through dentists. When you see Opalescence Go listed on Amazon or eBay, it is not being listed by Ultradent. It is a dentist like yourself who has decided to sell their Opalescence Go. They purchase from us. They have a dental license number. We don't sell to anyone who doesn't have a dental license number. If it's available on Amazon, it is either sold by one of your colleagues who is a licensed dentist, or it is sold as a counterfeit because Ultradent is not placing those online. And if you click in the actual unit that's for sale, you can see the person who is selling it. It'll tell you right there, and it says Opalescence Go by Ultradent, sold by whichever company, which the dentist has created a name for. So I hope that clears it up, but if not, you and I can have a dialogue on Facebook Messenger afterward, and feel free to abuse me. I've heard this many times. We have another question from Dr. Jonathan Michael. Can you tell Dr. Michael, have you ever used Zoom by Philips?
Oof, no.
And you never have?
No, and Zoom specifically, the Zoom 2 is to be honest, I think it is marketing, the worst side of marketing, because it was based on this photo-phantom reaction. Remove the photo, it's the phantom reaction. The phantom reaction is when you place a little iron. This is the Zoom 2, the Zoom 2. The Zoom 2, you have to place a little iron varnish on the tooth, and this iron reacts with hydrogen peroxide. And we know what happens when you use, hydrogen on a small bruise that has blood. The blood has iron on the hemoglobin, and it reacts a lot. We see bubbles, we see that foam, there's a foam there. Because peroxide goes crazy when there's iron involved. And the phantom reaction is a very powerful reaction. It was not discovered because of bleaching. It is used in bleaching, it was used in Zoom, and in my opinion, it's too strong, too hard to control. It's like the peroxide turns into a rabid dog. There is no control on that reaction, and I really don't like it. It was too much marketing involved. I don't see any problem with that. It doesn't bring problems to the patient, and in Brazil was never that popular, which I think it is a good thing. It was there, but very limited. But again, something that scares me a little bit. The phantom reaction, actually, if you have the time, Dr. Michael, to take a look on that, I think it is a little dangerous also because the phantom reaction was discovered after the nuclear problems. This is nuclear poisoning as well. So that's when the phantom reaction was discovered. It is used to clean wastewater. So it's a very strong reaction. I don't think it is that safe to use. I don't think it is needed to use orally, the phantom reaction. I think there's, again, stability. I like stability. I think stability brings everything that we need and the phantom reaction is the opposite of stability, is the uncontrolled reaction of a peroxide.
Interesting. We have another question. I'm sorry, doctor, I don't read Arabic. His name is written in Arabic. But he says, is there risk for root resorption after using bleaching agents?
Oh yeah. Specifically, root resorption can be a risk, especially, obviously, more in the cases where we had the root canal treatment and when those teeth, they had some history of trauma. So there's a history of trauma, and trauma can be also bruxism. So if there's any dentin that might be exposed not to the oral cavity, but into the gingival tissue inside, we have risks. So the risk of root resorption is bigger, obviously, on the tooth, on the teeth, that they have a root canal treatment, and root canal treatment where some trauma might be involved. So on those cases, I think it is very important to take that into consideration and sometimes even lower the concentration. That's the example that I gave, some internal bleaching, some walk-in bleaches that I opted, specifically the cases where there was trauma involved, and because I'm not that safe as an endodontist, that the seal that I did is that good, sometimes I might opt to use a lower concentration. I know it will take longer. I know sometimes it takes 1, 2, 3 months to bleach, but it's also another option to take that into consideration as well.
Thank you. Dr. Paula Tremble-Young, who's a great friend of us on Facebook Live. I've never met you in person, but I hope to someday. I think she practices in Colorado.
Nice.
Evergreen Dental, if I'm not mistaken. She comments that lights just dehydrate the teeth, which is what makes them look whiter.
Exactly, I agree.
And also that enamel microabrasion in combination with bleaching gives fantastic results. So thank you for that, Dr. Tremble-Young, and we appreciate you
Exactly.
tuning in.
It's a good input. Thank you as well, because that's also light helps the dehydration and coating. Gerald Kugel again, you can use a hair blower to do that as well. So instead of using a light, then you can use a hair dryer. So you also get good. It's not long lasting, but at least it's fast.
I should have done that before Facebook Live today, huh? Fast. That seems to be all the questions that we have today for the Facebook Live on tooth whitening. But remember, at 10:30, which is about 45 minutes from now, if you're on a different time zone than us, we're coming back, myself and Dr. Beolchi, to talk about direct composite veneers, specifically with the U-veneer system. So be sure to join us for that. Happy birthday again to Dr. Beolchi.
Thank you.
Thank you all for joining us today on Facebook Live. Thank you for being here with us for our summit and for letting us abuse you and just use you every second that you're here.
It is not abuse at all. It's a pleasure to be amongst friends and being able to help. It's always fun.
Great. Thanks for tuning in.